My name is Samantha Fong. I am a physical therapist. I work here at Highlands Rehab in El Paso, Texas. I'm going to be talking to you about orthopedics. So typically the type of orthopedic patients we might get here are total knees, total hips, and all types of back surgeries. So let's talk about why patients would get these type of surgeries. So for back surgeries, typically patients will have a lot of pain in their back area. A lot of them will have radiating pain down into one leg or maybe both. Typically it'll be because of nerves being compressed by the discs or narrowing of the canals, and that's typically due to osteoarthritis. So now we're total hips. Typically it'll be due to damaging of the hip, or again, most common thing is because of osteoarthritis. Same thing with total knees. It's to relieve pain from the knees. Typically these patients can't walk or have trouble walking, can't climb stairs, and have a lot of trouble getting in and out of chairs. And again, most common reason is due to osteoarthritis. So why do these patients need inpatient rehab? Typically it's because they need to regain their strength in order to improve their function to go home. So biggest thing that we will typically focus on these patients is gaining their strength back and getting their functional mobility. So that includes bed mobility, so that's rolling in and out of bed, sitting up in bed, transferring back to the chair, making sure that they're safe with all of these things in order to go back home. Typically their therapy will consist of strengthening, whether it's the ankle, hip, and knee, back strengthening, core strengthening, endurance training, in order to regain the endurance that you need to be able to do the things that you do daily as far as your functional activity tolerance. As soon as you get out of surgery, most patients are in bed for a very long time, and that they get very deconditioned. The other things that we focus on is balance training, because balance is very important for safety and to prevent falls, especially after having surgery, because typically your muscles are very weak. And the other thing that we'll focus on obviously is improving gait, stair negotiation, whether you do or do not have stairs, because in the real world patients will typically have to go up and down curbs, up and down ramps, walk sidewalks, uneven terrain, carpet, grass. So if we have the chance and the patients are appropriate, we will start training them on those things as well in order for them to be safe at home, because a lot of these patients will go back home on their own or with very little supervision, and that is our goal for them to be able to go back to doing all those things. So typically the recovery process for a back surgery can be 3 to 4 months. It might take even up to a year, because it takes that long for those bones to heal and to be well in order for you to start doing your daily activities and be able to do the things that you were doing once before. As far as recovery process for hips, most patients can start walking and doing their daily activities within 3 to 6 weeks. However, it will take a couple of months in order to be able to get back to their regular routine. And as far as total knee replacements, it takes about 6 weeks for patients to be able to do their daily activity, activities of daily living, their normal regular routine around the house. It can take 3 to 6 weeks for them to start driving, but it also will take 4 to 6 months or even up to a year for them to feel at 100% after their surgery. So most of these surgeries will take varies amount of time, 12 to a year. Of course, it does depend on each patient. Each patient is very different and will recover different, and depending on how they do with therapy, it can be within this time frame, or it might take a little bit longer.